Don't miss these 7 early signs of lung cancer, it could save your life. Every year, lung cancer silently claims thousands of lives, often because the symptoms are ignored or mistaken for less serious conditions. Lung cancer is one of the most common and deadliest cancers, but what if I told you that recognizing just a few subtle symptoms early could make all the difference? According to the American Cancer Society, over 230,000 new cases of lung cancer will be diagnosed in the United States this year alone. Tragically, more than 127,000 people will die from this disease. However, the good news is that when caught in its earliest stages, lung cancer is often treatable and survival rates increase dramatically. The challenge is that early symptoms are often vague and easy to dismiss. I can already hear the doubts. I don't smoke, or I'm too young for lung cancer. These dangerous assumptions prevent countless people from recognizing early warning signs. While smoking is a major risk factor, non-smokers are not immune. Risk factors like exposure to radon gas, secondhand smoke, air pollution, and even family history can significantly increase your risk of lung cancer. In the next few minutes, I'm going to break down the early signs of lung cancer that everyone needs to know, regardless of age or lifestyle. This isn't just information, it's a potential lifesaver. Let's dive into the first sign. Sign 1. Persistent cough that won't go away. A persistent cough lasting more than 2 weeks, especially one that seems to worsen over time, is one of the hallmark early signs of lung cancer. Unlike the temporary coughs associated with colds, allergies, or respiratory infections, this type of cough does not respond to over-the-counter medications or home remedies. It may start as a subtle, dry irritation but can progress to include mucus production, which may range from clear to yellow, green, or even streaked with blood, a symptom known as hemoptysis. The presence of blood, even in small amounts, is a significant red flag that warrants immediate medical attention, as it can indicate that a tumor has begun to irritate or damage nearby blood vessels. This type of cough may also be accompanied by other changes that can help distinguish it from benign causes. For instance, the cough may occur more frequently at night, disrupting sleep, or during physical activity, when the lungs are under increased strain. Some people describe it as a nagging sensation in their chest, as if something is stuck or irritating their airways. Over time, the cough can become more forceful and painful, as it places repeated strain on the chest muscles and throat, potentially leading to hoarseness or a sore throat. What makes a lung cancer-related cough particularly concerning is its persistence and progression. In cases where the cancer is located near the central airways, the cough may also be accompanied by wheezing or a high-pitched whistling sound as air struggles to pass through narrowed or obstructed passages. Additionally, a chronic cough might bring on episodes of shortness of breath or chest discomfort, which can be mistaken for asthma or other non-cancerous conditions, delaying proper diagnosis and treatment. Another important aspect to consider is the context of the cough. For current or former smokers, a new or worsening cough should raise immediate concern, as smoking remains the leading cause of lung cancer. However, non-smokers are not immune. Factors like exposure to secondhand smoke, radon gas, air pollution, or a family history of lung cancer can also increase risk, making any persistent cough a reason for evaluation, regardless of smoking history. It's critical not to dismiss a lingering cough, especially if it becomes a consistent part of daily life. If the cough is accompanied by additional symptoms like unexplained weight loss, fatigue, or recurrent respiratory infections, the likelihood of an underlying serious condition, such as lung cancer, increases. Seeking medical advice early can lead to timely diagnosis and treatment, which is crucial for improving outcomes. A persistent cough is more than just an annoyance, it's your body's way of signaling that something might be wrong. Listen to it. Sign 2. Shortness of breath or wheezing. Shortness of breath or wheezing is another early but often overlooked sign of lung cancer. If you find yourself becoming unusually winded while performing everyday activities that used to feel effortless, such as climbing stairs, walking short distances, or even speaking for extended periods, it may indicate an underlying issue with your lungs. This symptom occurs when tumors grow within or near the airways, either partially obstructing the flow of air or pressing on the lungs, reducing their capacity to function properly. In some cases, the obstruction is so gradual that individuals may unconsciously adapt their lifestyle to avoid exertion, further delaying detection. Wheezing, characterized by a high-pitched whistling sound when you breathe, is another common sign that the airways are being narrowed or compressed. While wheezing is often associated with conditions like asthma, allergies, or chronic obstructive pulmonary disease, COPD, when it appears suddenly or persists despite treatment for these conditions, it should be taken seriously. Lung cancer-related wheezing is typically resistant to common asthma medications like inhalers, as the root cause is structural rather than inflammatory. Shortness of breath can also become more noticeable during specific situations, such as lying flat, bending over, or speaking for long periods. This positional nature of the symptom may suggest that tumors are pressing on certain areas of the lungs or diaphragm, further limiting airflow. Some individuals may also experience chest tightness, fatigue, or a sensation of not being able to get enough air, all of which can be mistaken for anxiety or general deconditioning. For non-smokers, shortness of breath is particularly concerning when it appears without a history of respiratory issues. Factors such as exposure to radon, secondhand smoke, or occupational hazards like asbestos can contribute to lung cancer risk, making it important to consider all potential causes. In smokers or former smokers, this symptom might be attributed to the long-term effects of smoking, which can delay diagnosis if not investigated thoroughly. If shortness of breath or wheezing persists, especially if it is accompanied by other symptoms, like a persistent cough, chest pain, or unexplained weight loss, it's essential to consult a healthcare provider. Early recognition of these symptoms can lead to faster diagnosis and more effective treatment. Don't dismiss these changes as a normal part of aging or being out of shape. Your lungs may be trying to tell you something much more serious. Sign 3. Chest pain. Persistent chest pain that doesn't subside with rest or over-the-counter medications is a critical and often overlooked early warning sign of lung cancer. Unlike temporary discomfort caused by muscle strain or minor injuries, this type of pain can feel sharp, dull, or like a deep, unrelenting ache. It is often aggravated by activities such as coughing, laughing, or taking deep breaths. The pain may also be localized to one side of the chest, or spread to the shoulders, back, or even the arms, depending on the tumor's location and the structures it affects. Lung cancer-related chest pain occurs when tumors invade or press against sensitive structures within the chest, such as the chest wall, ribs, or nearby nerves. For example, tumors near the pleura, the thin lining of the lungs and chest cavity, can cause pleuritic pain, a sharp sensation that worsens with breathing or movement. If cancer spreads to the ribs or spine, it can lead to bone pain, which feels deep and persistent, often worsening at night or with physical activity. In some cases, the chest pain might not originate from the tumor itself but from secondary effects of lung cancer, such as fluid accumulation in the chest cavity, pleural effusion, or inflammation caused by the body's immune response to the cancer. Pleural effusion can create a sensation of tightness or pressure in the chest, accompanied by shortness of breath. These symptoms may not improve with rest, making it crucial to recognize them as potential signs of a serious underlying condition. It's important to note that chest pain related to lung cancer can mimic other conditions, such as heart disease, acid reflux, or even anxiety, leading many to dismiss it as something less serious. However, pain that persists or worsens over time, especially when accompanied by other symptoms like a chronic cough, unexplained weight loss, or fatigue, should never be ignored. Even if the pain is mild, its persistence is a signal that something may be affecting the lungs or nearby structures. If you experience persistent chest pain that does not improve with typical remedies, or seems to intensify with coughing, laughing, or deep breathing, it's essential to consult a healthcare provider. Early diagnosis of lung cancer can significantly improve outcomes, and addressing this symptom promptly could make a life-saving difference. Your body is sending you a message, don't dismiss it. Sign 4. Unexplained weight loss. Unexplained weight loss is a significant red flag for lung cancer and many other serious health conditions. This symptom is often one of the first noticeable signs of an underlying issue, particularly when weight loss occurs suddenly and without any changes to diet, exercise, or lifestyle. Cancer cells are known to consume a disproportionate amount of the body's energy as they grow and spread, effectively hijacking the body's metabolism. This increased metabolic demand causes the body to burn calories at an accelerated rate, leading to unintentional weight loss even in individuals with normal or increased food intake. For people with lung cancer, weight loss can also result from changes in appetite or eating habits. Tumors in the lungs or nearby areas can cause fatigue, making everyday tasks, including eating, feel burdensome. Additionally, lung cancer can trigger nausea or discomfort during meals, leading to reduced food consumption over time. Some patients experience early satiety, a feeling of fullness after eating only small amounts, which further contributes to inadequate calorie intake and subsequent weight loss. Weight loss associated with lung cancer is often accompanied by muscle wasting, known as cachexia. Cachexia is a complex condition in which the body not only loses fat but also breaks down muscle mass, resulting in visible thinning and weakness. Unlike weight loss from dieting or exercise, cachexia is difficult to reverse with increased calorie intake alone because it is driven by the systemic effects of the cancer itself. This can leave individuals feeling physically weaker and less capable of performing daily activities, further impacting their quality of life. In addition to physical effects, unexplained weight loss can have a psychological toll, causing individuals to feel anxious or depressed about their health. Unfortunately, this symptom is often dismissed or attributed to stress, aging, or temporary illness, delaying a proper diagnosis. However, a significant drop in weight, commonly defined as a loss of 5% or more of body weight, over 6 months should always prompt further investigation, especially when accompanied by other potential signs of lung cancer, such as a persistent cough, shortness of breath, or fatigue. If you notice unexplained weight loss, even in the absence of other symptoms, it's essential to seek medical advice. Early detection of lung cancer or other conditions associated with this symptom can lead to timely intervention and better treatment outcomes. Weight loss is not just a number on a scale. It's a signal from your body that something may be wrong. Don't ignore it. Sign 5. Fatigue that won't go away. Persistent fatigue is one of the most common yet easily overlooked signs of lung cancer. Unlike normal tiredness caused by a busy schedule or lack of sleep, cancer-related fatigue is profound and unrelenting. It doesn't improve with rest or sleep and often leaves individuals feeling completely drained, even after minimal physical or mental activity. This type of fatigue is not just about feeling sleepy, it's an overwhelming sense of exhaustion that can significantly interfere with daily life. The fatigue associated with lung cancer occurs because the disease affects the body on a systemic level. Cancer cells consume a disproportionate amount of the body's energy, leaving less available for normal functions. Additionally, the immune system often works overtime to fight the cancer, which can further deplete energy reserves. Tumors in the lungs may also reduce oxygen levels in the blood, contributing to feelings of weakness and shortness of breath, even during simple tasks. These effects combine to create a cycle of exhaustion that is difficult to break. In the early stages of lung cancer, fatigue may precede more obvious symptoms like coughing, chest pain, or shortness of breath. This can make it particularly challenging to recognize as a warning sign. People often attribute their fatigue to stress, aging, or other lifestyle factors, delaying diagnosis and treatment. However, the persistence and intensity of cancer-related fatigue set it apart. It's not uncommon for individuals with lung cancer to describe feeling like they're running on empty no matter how much rest they get. Fatigue may also impact mental and emotional well-being. Many individuals experience difficulty concentrating, memory problems, or a lack of motivation, which can affect work performance and relationships. These cognitive symptoms, often referred to as chemo brain in cancer treatment but also present in early stages, highlight how deeply fatigue can permeate daily life. For some, this overwhelming exhaustion leads to feelings of frustration, sadness, or isolation, compounding the physical challenges of the disease. If you're experiencing persistent fatigue that doesn't improve with rest, and it's interfering with your ability to perform everyday activities, it's essential to consult a healthcare provider. While fatigue is a common symptom of many conditions, its presence alongside other potential signs of lung cancer, like unexplained weight loss, a lingering cough, or shortness of breath, should prompt further evaluation. Fatigue is more than just feeling tired, it's your body signaling that something isn't right. Early recognition and intervention can make all the difference. Don't ignore it. Sign 6. Hoarseness or voice changes. A persistent change in your voice, such as hoarseness, raspiness, or a weaker tone, can be an early warning sign of lung cancer, particularly when it lasts for more than 2 weeks, and does not improve with rest or traditional treatments. While hoarseness is often associated with benign conditions like colds, allergies, or vocal strain, its persistence may indicate a more serious issue, especially if there are no clear triggers or accompanying symptoms like a sore throat. Hoarseness or voice changes in lung cancer typically occur when a tumor presses on or irritates the recurrent laryngeal nerve, a branch of the vagus nerve that controls the vocal cords. This compression can interfere with the cord's ability to vibrate and produce sound, resulting in a voice that sounds strained, raspy, or unusually breathy. In some cases, individuals may notice a complete loss of vocal strength, making it difficult to speak loudly or maintain conversation without effort. This symptom may be more subtle at first, often presenting as a mild change in pitch or tone that becomes more pronounced over time. People who use their voice professionally, such as singers, teachers, or speakers, might notice a reduced vocal range or difficulty sustaining notes before others recognize the change. Additionally, voice fatigue, where speaking feels increasingly effortful, can also accompany hoarseness. What sets lung cancer-related hoarseness apart is its resistance to typical remedies. While hoarseness from a cold or overuse usually resolves within a week or two, hoarseness caused by a tumor persists and may even worsen as the cancer progresses. This is because the underlying issue isn't related to inflammation or irritation but rather to the mechanical impact of the tumor on nearby structures. It's also important to consider other symptoms that might occur alongside hoarseness, such as a persistent cough, difficulty swallowing, or shortness of breath. These additional signs can help differentiate lung cancer from other conditions that might cause similar voice changes. If you experience persistent hoarseness or voice changes without a clear cause, especially if it is accompanied by other potential warning signs of lung cancer, it's crucial to seek medical attention. A healthcare professional may recommend imaging studies or otolaryngoscopy to investigate the underlying cause. Early detection of lung cancer can significantly improve treatment options and outcomes. Don't ignore changes in your voice. What seems minor could be your body's way of signaling something much more serious. Sign 7. Frequent respiratory infections. Frequent respiratory infections, such as recurrent bronchitis or pneumonia, can be a subtle yet significant warning sign of lung cancer. While occasional respiratory illnesses are common, especially during colder months or flu seasons, experiencing these infections repeatedly or having symptoms that linger despite appropriate treatment is cause for concern. Lung cancer can create an environment in the lungs that promotes the growth of bacteria and viruses, leading to chronic or recurring infections. This occurs because tumors in the lungs can block or partially obstruct airways, trapping mucus and debris. These obstructions provide an ideal breeding ground for bacteria, making infections more likely and more difficult to clear. Additionally, lung cancer can weaken the immune response locally within the lungs, further increasing susceptibility to infections. As a result, individuals may find themselves battling respiratory illnesses more frequently than usual or noticing that infections take longer to resolve, even with antibiotics or other treatments. What sets cancer-related respiratory infections apart is their persistence and pattern. Infections might recur in the same area of the lungs, as tumors often cause localized blockages. Symptoms such as a persistent cough, chest congestion, wheezing, or shortness of breath may accompany these infections, even when the acute phase of illness seems to improve. Some individuals might also notice fatigue or fever that lingers, further indicating that the underlying issue has not been fully resolved. Frequent respiratory infections are often mistaken for unrelated conditions like asthma, chronic obstructive pulmonary disease, COPD, or seasonal allergies, delaying a proper diagnosis. However, if these infections become a recurring problem or fail to respond to typical treatments, it's critical to consider the possibility of an underlying condition like lung cancer. This is particularly important for individuals with additional risk factors, such as a history of smoking, exposure to environmental toxins, or a family history of lung cancer. If you find yourself dealing with repeated or lingering respiratory infections, consult a healthcare provider for further evaluation. Diagnostic tests such as chest X-rays, CT scans, or bronchoscopy may be necessary to identify any abnormalities in the lungs. Early detection of lung cancer, even in the context of infections, can lead to timely and effective treatment. Frequent respiratory illnesses are more than just a seasonal inconvenience, they may be your body's way of signaling that something is wrong. Don't ignore the signs. Are you at risk? Now that you know the early signs, let's talk about risk factors. Smoking remains the leading cause of lung cancer, but exposure to secondhand smoke, radon gas, air pollution, and certain workplace toxins like asbestos are significant risks as well. Family history and previous lung diseases, such as chronic obstructive pulmonary disease, can also increase your risk. Even if you don't have any of these risk factors, early symptoms should never be ignored. If you or someone you know is experiencing these signs, don't wait, schedule a medical evaluation immediately. Lung cancer is treatable, but only if caught early. Thank you for watching. If you found this information helpful, please give this video a like and subscribe for more life-saving health content. Don't forget to check out the other videos on your screen for more valuable insights. See you there.